Well, first of all, I'm very proud of the designation, and I was very excited to receive it a couple of years ago. And I think it's important for health managers to have professional certification. And you know, I wish that when I started working that I had access to this type of education to do the work that I do in the communities. Well, today I sat in a workshop that was very relevant to some of the work that I do on mental health, and it provided me with the latest information, latest research, evidence. So I think you know, you can go to one place and over 2 or 3 days and have access to this information that you wouldn't have access to anywhere else. Well, I think it's always, well, I've been a lifelong learner, and you know, I think in any profession you're encouraged to have that continuous learning, and this is an opportunity in the health field that, you know, they have a curriculum that's specifically designed for health managers. So I think it would not only would benefit the health managers, but also their staff in getting the latest knowledge and experience and skills to help them do their job better. Well, you know, I think if you're a tribal council or you have a larger, or maybe even a smaller health services, it might be interesting, and I don't know if they do this, you know, where you would have a session where your community, maybe other communities, pull together to do a session. And you know, in work that I've done before, I know that community members want education delivered in their communities, and I think it's important because it creates that context for you. So if people developed, you know, get 2 or 3 First Nations together to develop a curriculum just for them, and maybe have some of the material adapted for their particular situation, it would be beneficial. I just love First Nations Health Managers Association. You know, I think it's critical, particularly in an area where a lot of our community members are not well, you know, so it does good work.